Dear Dr. Goldberg, Dr. Hazorif, and most importantly, the senior nursing officers and leaders that are here today. My name is Maggie Langens, and I am the Nursing and Midwifery Policy Advisor at the WHO European Regional Office. It is my great pleasure and honor to bless your event today and share a few reflections on our joint priorities, the challenges, but also opportunities to strengthen nursing across the WHO European region. And specifically, those of you working in leadership roles. But first, I would like to take this opportunity to really say how grateful we are at the WHO European Regional Office for all the work you and your nurses have done and continue doing during the pandemic and beyond, but also in Ukraine, as I know some of you are involved in the relief efforts there. We really thank you for your hard work and commitment and appreciate that this has been at the cost of great personal sacrifice and, sadly, personal loss. It is our duty at the WHO and our commitment to you to ensure that you are supported, protected, and your contributions are made clear at every moment that we connect with decision makers on the international stage. As some of you may already know, last May at the WHO World Health Assembly, all 193 member states endorsed the first ever resolution to implement the global strategic directions for nursing and midwifery. In key priority areas for strengthening nursing and midwifery in service delivery, in jobs, in leadership, and education. All these areas are highly important and closely interconnected. But I'd like to speak to the role of these investments, especially in leadership. The importance of leadership cannot be overestimated, especially as we slowly emerge from the pandemic. We see that more than ever, our communities and patients need us, nurses, to protect and engage with them where they are when they need it. We know that nurses and midwives are really well positioned and have always been well positioned to support the mental health needs and chronic disease management that has always been necessary and will need more attention than before the pandemic. Your work is possibly the most important in making our societies and communities healthier as we emerge from this pandemic. Your lens, the lens that sees the source of inequalities, that accompanies patients and their families from birth to death, that really knows what drives your patients to do as they do and not as they always can or should. This is the vital lens that is needed to make our societies healthier. As WHO, we are therefore not only working hard to put nursing and midwifery at the forefront of workforce priorities, but are also working hard to put primary health care front and center on the path towards achieving universal health coverage. When we look at the data that has emerged from the first WHO State of the World's Nursing Report in 2020, we see the enormous variation that exists across our regions, but also in terms of jobs, education, leadership, and service delivery between hospitals and communities. That is why primary health care and community health, particularly mental health, immunization, and behavioral health in the community is at the core of the WHO Regional Office for Europe's roadmap to implement the global strategic directions over the next 5 years. We launched this under my leadership in December, and among them is supporting our government chief nurses to optimize their impact, their voices, and to strengthen a pipeline of nursing leaders that can lead services, organizations, and governments to deliver better on health. The good news is that several leadership initiatives are taking place across the region, including in Israel, which inspires and has us really listening closely to what you and what other member states can learn. We've also captured these in the various snapshots that accompany the roadmap. What will be important now is to scale up the commitment at the global scale for nurses and midwives. Our regional director, Dr. Hans Kluge, said, "Your needs as leaders to thrive have come into sharp focus with the Pan-European Commission on Health and Sustainable Development, which has really worked to rethink health policies in the light of the pandemic." In its recommendations to governments and policymakers, the Commission makes an unequivocal call to reduce gender inequalities and invest in the workforce. Women make up 90% of the nursing and midwifery workforces, but also more than 60% of the health workforce. This means that if we are serious about reducing gender inequalities and supporting the workforce, we need to act in real, tangible ways that we can protect and care for our nurses and midwives to create conditions that attract more people to the profession and retain those who have dedicated their time already. As the Secretary General of the United Nations, Antonio Guterres, said, "It is time to stop trying to change women and start changing the systems that prevent them from achieving their potential." Which brings me to my final appeal to each and every one of you as leaders. Your leadership in demonstrating the impact of what you do and raising your governments and our attention to your needs to make your work safe, viable, and attractive for future generations will be critical. As much at the local level and at the service level, but also at the highest level in policy making and at the decision-making table. When I was appointed the Nursing and Midwifery Policy Advisor this time last year at the WHO Regional Office for Europe, I did not take this offer lightly. But because I had worked with people like Shoshi and Elizabeth Iro and seen firsthand the power of what nurses and midwives do in the community, in hospitals, and all the spots in between, but also know what our profession has done for hundreds of years, I embarked on this position with confidence. Dear senior nursing officers and nursing leaders of Israel, I feel this is a very exciting time for leaders in our profession, a sort of point of no return, a launch of so much more for us as nurses and midwives and for our patients. I really wish you a most successful conference and look forward to meeting you one day and also hearing from you. Thank you.